on All About Skin Allergy. I'm your host Deepti Diwan. Ladies and gentlemen, we all know the importance of healthy skin. Our skin is the largest organ in the body and it has many roles in the maintenance of life and health. A healthy skin acts as a barrier. It helps us fight off bugs, allergens, toxins, and carcinogens. It gives us the sense of touch, acts as a thermoregulator, and also helps in wound healing. On the contrary, a skin allergy is when the skin becomes irritated because the immune system reacts to something that is usually harmless. This is called an allergic reaction. Symptoms can include scaly, itchy skin, bumps, redness, blisters, welts, and rashes. It can cover the entire body or a few areas of the body. And it is very important to address the allergic reactions and provide the right treatment at the right time. Today, we shall be discussing a particular skin condition known as urticaria. जी हाँ, आज हम एक खास स्किन कंडीशन के बारे में बात करेंगे जिसका नाम है urticaria. And to answer your questions and concerns regarding urticaria, joining us live from Ahmedabad is Dr. Maitri Patel. Dr. Maitri Patel is a leading dermatologist in Ahmedabad and has an experience of 8 years in this field. She practices at Eva Skin and Laser Center in Satellite, Ahmedabad. She completed MBBS from Pramukh Swami Medical College, Karmsad in 2013 and MD in Dermatology, Venerology and Leprosy from Maharashtra University of Health Sciences, Nashik in 2017. Dr. Maitri Patel is an experienced, skilled, and awarded doctor in her field of specialization. Some of the service provided by her are wrinkle treatment, trichology, skin allergy treatment, dermabrasion, and microdermabrasion. So, welcome, doctor.
Good evening. Thank you for inviting me.
Absolutely, doctor. It's our pleasure. Thank you so much for joining us. हमारे साथ इस सेशन के लिए जुड़ने के लिए बहुत बहुत शुक्रिया. तो डॉक्टर, हमारे जो व्यूअर्स हैं वो अर्टिकेरिया के बारे में जानने के लिए बहुत उत्सुक हैं आपसे. दे आर रियली लुकिंग फॉरवर्ड टू दिस सेशन. तो शुरुआत करते हैं. डॉक्टर, सबसे पहले हमें प्लीज बताइए कि अर्टिकेरिया या हाइव्स ये एग्जैक्टली होता क्या है?
Urticaria is basically a common skin condition which has itchy, raised, edematous bumps. You can say in scientific language, it is a erythematous elevated plaque with transient appearance. It is characterized by mainly the central swelling of variable size surrounding reflex erythema and also associated with the pruritus or burning.
Okay. वेल थैंक यू सो मच डॉक्टर. एंड डॉक्टर, इसके मुख्य कारण क्या होते हैं अर्टिकेरिया के? व्हाट आर द मेन कॉजेज ऑफ अर्टिकेरिया?
The main causes of urticaria are allergic reaction due to food. So mainly the fermented items, sour items, then eggs, nuts. Sometimes it can happen after the viral infection. So in this situation, the post-COVID urticarial rash is very common and it is increasing in number. Then after the throat infection also, you can say after bacterial infection. Sometimes some people say see an urticarial rash in the blood after the blood transfusion also. Sometimes it can happen after the insect bite or insect sting. Otherwise, you can also appear with the physical stimuli like cold, pressure, heat, etc.
Okay. Well, thank you so much, doctor. With so many causes of urticaria, how exactly is urticaria diagnosed? इसका निदान कैसे किया जाता है?
अर्टिकेरिया का निदान मेनली डिटेल हिस्ट्री से ही होगा. सो वी हैव टू आस्क अ प्रॉपर स्पेसिफिक डिटेल हिस्ट्री, like ask patient that how it developed or after which event it developed. सो पेशेंट ही हमें बताएगा कि कुछ क्या हुआ उनके साथ, या तो वो बीमार हुए, या तो फिर उन्होंने ट्रैवलिंग किया, या तो समटाइम्स इंसेक्ट बाइट हुआ, या तो फिर कोई ड्रग रिएक्शन. So it will diagnose mainly by the history, then also physical examination, because this lesion appear anywhere in the body. So कभी कभी क्या होता है कि कोई सनलाइट से अर्टिकेरियल रैश होगा तो इट मेनली ओवर द एक्सपोज पार्ट, राइट, एंड समटाइम्स आफ्टर इंसेक्ट बाइट होगा तो इट विल ओनली अराउंड द insect bite lesion. So physical examination is very important. Then the laboratory investigation. So sometimes also arterial rash associated with some other skin disease, or you can say other systemic disease. So laboratory investigation are very important to rule out the any other systemic disease.
Okay. Well, thank you, doctor. डॉक्टर ये हो गई डायग्नोसिस की बात और कॉजेस की बात. अब ट्रीटमेंट के ओर बढ़ते हैं डॉक्टर. सो कुड यू प्लीज टेल अस व्हाट आर द अप्रोचेस टू ट्रीट एंड मैनेज अर्टिकेरिया?
Yeah. So mainly the two approaches are there. One approach is to eliminate the triggering factor and to avoid the, like you can say, avoidance of some kind of food. If you feel that after eating that food, you can get this urticarial rash. Second approach is we can give a antihistaminic medicine which is non-sedating. But first, you should consult proper dermatologist to take care of this treatment.
So you're saying antihistamines is the way to go for treatment?
Yeah.
Okay. Thank you so much, doctor. And doctor, are there any do's and don'ts in urticaria?
Yeah. In do's, first we should identify an elimination of the triggering factors. Then application of soothing agent like calamine or non-petroleum, non-medicated petroleum jelly we can apply. So it soothes the skin and it relieves the pruritus or burning. Then sometimes arterial rash develop after the excessive bathing, or you can say more duration of the bathing. So you can cut off the period of bathing or shorter the duration, and then of course you should consult a dermatologist first.
Okay. And
in don'ts, I will ask patient to avoid the food like eggs, nuts, peanuts, any fermented items or any Bengal gram items, or you can say sour fruits like lemon, amla, kiwi. So these are the mainly foods which can trigger the urticarial rash.
Okay. Well, thank you, doctor. And doctor, अगर किसी को पहली बार हो रहा है urticaria, so they may not be able to identify it. So how can one easily identify urticaria?
Urticaria is differentiate from the other condition in this way. The urticarial rash is the transient. It can occur anywhere on the body. The shape, size, number is variable. So you can say sometime patient will say sometimes there is a one lesion. After 30 minutes, he or she will develop 30 lesion. So it is variation in number and size. It also associated with the excessive itching, or sometimes patient will tell you that after the itching, he or she will develop this kind of rash.
Okay. And doctor, then how long does urticaria last?
There is no specific time. The urticarial rash lasts from minutes to hours, or sometimes 1 or 2 days. But we can cut off this duration by the proper medication.
Okay. This you're talking about each episode of urticaria?
Yeah.
Okay. And doctor, so in that case, what are the immediate treatment options for urticaria? अगर किसी को immediately कुछ करना है, तत्काल उपचार उन्हें करना है, तो वो immediately क्या कर सकते हैं?
For immediate relief, you can buy a non-sedating antihistaminic drug in the medical shop. So it will resolve your urticarial rash within half an hour to 1 hour.
Okay.
And after that, you can consult a dermatologist.
Okay. Well, thank you, doctor. Let's see if we have questions from the audience. So, doctor, could you please tell us if इसके diagnosis के लिए क्या कोई allergy test करना ज़रूरी है उसके पहले?
Yeah, allergic test करना जरूरी है, but rather than allergic test, हम ये suggest करेंगे कि पहले आप proper जो triggering factors है उसको आप find out करो. If you think that इनकी वजह से आपको arterial rash हुआ है, then अगर आप avoid करोगे तो definitely you will resolve this rash. So there is no need of allergic test. But if the episodes are recurrent, or you can say it can like it can long like 6 months to 1 year, then you can definitely go for the allergic test.
Okay. And doctor, any medicines which commonly cause urticaria?
Yeah, for medication, antibiotic, some group of antibiotic is definitely there are high chances of arterial rash. Then brufen, which we are using like on and off every time for the painkiller. Then aspirin. So mainly senior citizens are daily using this aspirin drug. So these are the drugs. It will cause arterial rash.
Okay. And doctor, is it common in any particular age group or any gender जिसमें देखा गया कि इन इस एज ग्रुप में या इस जेंडर में अर्टिकेरिया ज़्यादा होता है?
There is no as such a specific age group, but yeah, you can say it is mainly seen between the 20 to 40 years of age.
Okay.
But even child can develop arterial rash, but it may be 1 or 2 times, while this age group is more frequently develop arterial rash.
Okay. Between 20 to 40 years.
Yeah.
Okay. And is it more common in men or in women? Any such scientific?
No, there is no such scientific ratio.
Okay. Sure. Thank you so much, doctor. And doctor, is urticaria inherited or is it genetic?
No, there is no any relation between like inherited or genetic. It's a autoimmune condition, or you can say it is associated with the hypersensitivity reaction. So it is not genetically inherited.
Okay. Thank you, doctor. And our viewer would like to know, doctor, any foods that they can include in their diet to get fast improvement?
No, there is no such kind of food which will get a fast improvement. So basically, there is no role in food to relieve the urticarial rash.
But they can avoid certain foods to avoid
Yeah,
it.
yeah.
Right. Thank you, doctor. Our next viewer would like to know what is the difference between urticaria and angioedema?
Yeah. In angioedema, there is a diffuse swelling, or you can say there is a extravascular compartment. There is a edematous reaction to subcutis and dermis. So it is a localized diffuse swelling in angioedema. So in angioedema, you can say there is a swelling of lips, swelling of eyes, like this. In urticarial rash is mainly developed over the skin area.
So, doctor, in that case, then that is a very serious condition, right? Almost
Yeah.
emergency, angioedema.
Yeah.
Okay.
Yeah.
Thank you, doctor. And doctor, urticaria में generally itching या burning होता है. So, उसमें difference क्या होता है between itching and burning?
ईचिंग एंड बर्निंग में ज्यादातर डिफरेंस यही है कि ईचिंग इसलिए होगा कि वहां पे एक जो केमिकल आता है, इट्स अ हिस्टामाइन, सो इट विल इंक्रीज द ईचिंग.
Okay.
And burning, yeah, and in burning is mainly due to there is a extravasation of the fluid from the intravascular compartment, so there is burning is there.
Okay. तो उस वक्त फिर हम उस burning या itching के लिए क्या कर सकते हैं?
Same, there's an antihistaminic medication you will take, and it is easily available like Avil and Dexona. So it is you can take as an emergency condition. So it will resolve in 30 minutes of this time.
Okay. Thank you, doctor. And our viewer would like to know what kind of foods should not be included in diet during urticaria.
As I say, fermented foods, then sour items or sour fruits, okay. Then Bengal gram items like chane ki, like besan ki items, sorry. Then dairy products, white sugar, breads, and gluten diet.
जी, ये सब उन्हें अवॉइड करना है.
Yeah.
Okay. Thank you, doctor. And doctor, our viewer has another question. They would like to know if geographical location affects allergy or urticaria.
No, there is no such geographical relation to arterial rash.
Okay. And what about pollution, doctor? Is there any relation between pollution and urticaria?
Not much, but yeah, pollens and dust can develop arterial rash in like hardly 5 to 10% of population.
Ji. So, doctor, let's talk about side effects in medicines that they take for urticaria. One of the side effects is known to be that is of sedation. लोगों को काफी नींद आती है medicines के बाद. What are the other side effects, doctor, and how to avoid these side effects?
Basically, these antihistaminic drugs are very less side effect. So, as you can say, sedation is the first side effect, and it is a major side effect, as if I know till the side effects part. Nowadays, many antihistaminic will come in the market. There is no sedation, or you can say zero sedation. Otherwise, no any major side effect. You can continue your antihistaminic tablet lifelong also.
Okay. So not major side effects you're saying.
Yeah.
Okay. Thank you so much, doctor. And अगर sedation किसी को होता है medicine से तो then उनके लिए डॉक्टर क्या alternative है? Suppose if a person has urticaria but they have to drive or if they have to travel somewhere, then any particular tips or any precautions for them, doctor?
Only he or she can take a non-sedating antihistaminic. And this newer in market, it is a Bilastin 20 milligram. The company claim that even pilot can take this medication without hesitation. So only this way to avoid sedating antihistaminic.
Okay. Well, thank you, doctor. And doctor, do you have any home remedies that can help in treatment of urticaria?
No, as such home remedies, but yes, you can apply soothing agent for to relieve this pruritus or burning or itching. So one is the aloe vera gel. You can apply our natural aloe vera, so it soothes the skin and it relieves the symptom.
Hmm. Right. Thank you, doctor. Doctor, you have spoken about a lot of causes of urticaria. It could be food items, it could be certain medicines, certain drugs, or infections. Doctor, let's talk about emotional problems or stress. Do you also see in your experience, in the industry, do you also see a relation between stress, mental stress, and urticaria?
Hardly in 2 to 5% of cases, not much cases. It's a stress-induced urticaria.
Okay. So very few, like less percentage.
Yeah, and it will only happen like someone is taking any antipsychotic drugs or any antidepressant drugs. So it is associated with these drugs, not because of stress.
Okay. Well, thank you so much, doctor. Let's see if we have any more questions from the audience. All right. I think we have finished all the audience questions. So thank you so much, doctor. That was indeed a great informative session. And thank you for answering all the questions of our viewers. It was indeed a delight to have you join us. So thank you once again for your valuable time. And ladies and gentlemen, I'll be sharing the details of doctor.
Yeah, thank you, Difti. It was a nice experience.
Thank you so much, doctor. So, like you can see, for all of you, we have shared the details of Dr. Maitri Patel right on the screen. For any queries regarding skin allergies or any other dermatology related questions, please feel free to consult doctor on these numbers. आप स्क्रीन पे देख सकते हैं, हमने डॉक्टर के डिटेल्स शेयर किए हैं. कोई भी सवाल हो तो आप डॉक्टर से इन नंबर पे कांटेक्ट कर सकते हैं. So once again, thank you so much, doctor, for that wonderful session and for answering all our queries. Uh, Ladies and gentlemen, thank you for joining us for yet another interesting and information-packed session. This is your host, Deepthi Diwan, signing off. Until then, please take care of yourselves and stay safe. Thank you so much.
Thank you and have a good day.